So one thing that I think is really becoming very important and very clear, at least to Dossia and to employers, is that we need to get back to what we used to have. We used to have a patient and a physician relationship, and that was what was held close to the heart of both physician and patients, and we've gotten away from that. We've gotten a lot of bureaucracy in the way, a lot of processes. Time constraints have gone from 20 minutes down to 7 minutes, and in that 7 minutes we're having very fulfilling interactions. The patient doesn't feel like they have enough time, the physician feels hurried, and they're doing a lot of busy work during that process. What I believe Health 2.0 and the Health 2.0 tools can do is optimize that communications. We can't have 20 minutes anymore, but what we can have is 7 minutes of a much more richer experience. So, for example, we can call it data-enhanced communications. So before the point of care, the physician sends out the information that the patient needs. They're doing their pre-surveys, they're doing their med rec, doing their complaints, but they're doing it in a very intelligent way. That information is routed to the care team and the physician. It's analyzed at the point of care. That information is leveraged, and so they're not talking about anything within those 7 minutes that could not have been done up front. Much more engaging, so instead of having 10 things to go through, I'm only going through 5 or 6, and those are much more rich. Then after the encounter, instead of saying, I'll see you in 6 months, you need to lose weight, you need to be more active, you say, look, our care team will check in on your PHR in a month, and we'll see how you're doing with the care plan we did, and if you're doing fine, great, but if we've got issues with the amount of exercise you're doing or your blood pressure, then we'll check on that, and if it's off plan, we'll get you back in, we'll correct it, we'll talk about it, and we'll get you on a new care plan. So there will be a feedback loop, and there'll be a sense of accountability, and it won't span lots of time that allows for the relationship to get loose. So the idea is that it's not an empowered patient or empowered physician independently. If they're both on the same page and their communications are enhanced, I believe with the tools that are being shown and being used at Health 2.0, Dossia and myself believes that that's really what we need to get back to, and I think there's great hope in that. There's great hope from the patient, there's great hope from the physician. It's professionally rewarding, and I believe that joint accountability will lead to a lot better outcomes for both clinically and professionally and personally for both the patient and the doctor.